morning, Ma'am Sok. Good morning, classmates. Today, I, Julian Taganan, together with Miss Lagora, Miss Divine Taganan, Miss Osorio, and Mr. O'Reilly will discuss physiologic changes of three different body systems that is common with age. Our discussion contains the structure and its function, the normal age-related changes, and abnormal conditions common with aging. First is the integumentary system, which includes the body membranes, skin, hair, fingernails, sweat, and oil glands. Our skin has multiple layers, which are epidermis, dermis, and hypodermis. These layers protects the body, regulate body temperatures, and help excrete wastes via sweats. So, the integumentary system is the first barrier that keeps good things such as water in and bad things such as harmful bacteria out. In the skin, these changes are reflected in decreased mitosis in the stratum basale, which plays a role in proliferation and attachment of the epidermis to the dermis. These changes leads to a thinner epidermis. The dermis, which is responsible for elasticity and resilience of the skin, exhibits a reduced ability to regenerate, which leads to a slower wound healing. And the hypodermis, with its fat stores, loses structures due to the reduction and redistribution of fat, which in turn contributes to the thinning and sagging of the skin. The accessory structures also have lowered activity, generating thinner hair and nails and reduced amounts of sebum and sweat. A reduced sweating ability can cause some elderly to be intolerant to extreme heat. Other cells in the skin, such as melanocytes and dendritic cells, also becoming less active, leading to a paler skin tone, graying of hair, and lowered immunity. Wrinkling of the skin occurs due to the breakdown of its structure, which results from decreased collagen and elastin production in the dermis, weakening of muscles lying under the skin, and inability of the skin to retain adequate moisture. So now, let's talk about age-related dysfunctions to the integumentary system. First, the acrochordon. Acrochordon is a condition which affects older women. It characterizes the small pendulous growth on the skin, or otherwise known as skin tags. Skin tags contains dermal connective tissues and blood vessels. They are thought to be associated with hormonal imbalances. Next one, the cubitus ulcers, or also known as bed sores. It is a condition which affects people who are bedridden or otherwise immobilized. The decubitus ulcers are characterized by cavities of dead tissue or necrosis that forms in the skin. The constant pressure from being immobile reduces blood flow to skin and irritates the tissue. Bacteria can then attack the weakened tissue. The next one is herpes zoster. It is a condition which can affect people of all ages, but it is most common in people between the ages of 50 and 70. Herpes zoster is also known as shingles. The disease is characterized by itching and aching pain, which is followed by the appearance of small red papules on the skin. Papules are replaced by small fluid-filled vesicles, which burst and can be quite painful. The disease is caused by the same virus that causes chickenpox. After entering the body and causing chickenpox, the virus lays dormant in the body for years only to reappear later in life. The fourth one is lentigo, which affects people above the age of 50 years. Lentigo, commonly known as liver spots or senile freckles, is characterized by blemishes on the skin associated with aging and exposure to ultraviolet radiation from the sun. They range in color from light brown to red or black and are located in areas most often exposed to the sun, particularly the hands, face, shoulders, arms, and forehead, and the scalp if bald. The next one is seborrheic keratosis, which affects middle ages and the older adult. The condition characterized by the formation of benign epidermal tumors. These flesh-colored, oval, raised plaques typically form on the face, scalp, chest, or back. Gradually, these plaques thicken, enlarge, and darken. Seborrheic keratosis is an inherited condition. Next is senile angiomas. It is a condition which affects 75% of people over the age of 70. The condition is characterized by red spots ranging from very tiny to over 1/4 inch in diameter. These spots are caused by clusters of dilated capillaries. Next is senile purpura. It is a condition which affects older people and characterized by irregularly shaped purple patches. These are bruises resulting from minimal trauma, mostly common found on the forearms and hands. As one ages, capillaries weaken and result in blood pools under the skin, leaving a bruise. The last one is senile pruritus. It is a condition which affects the elderly and characterized by drier and less pliant skin, which leads to the development of tiny cracks in the skin. The condition develops as a result of the gradual loss of oil-secreting sebaceous glands and sweat glands, as well as a reduction in the water content of skin.
And now let's talk about musculoskeletal system. The musculoskeletal system or the locomotor system is the internal frame of the body. It provides our body with movement, stability, shape, and support. It is subdivided into two broad systems, the muscular system, which includes the skeletal muscles and tendons, and the skeletal system, which includes bones, joints, and associated tissue, cartilage, ligaments, joint capsules, bursae. The musculoskeletal system is essential for protecting organs, producing blood cells, storing essential minerals, and anchoring skeletal muscles so that their contractions cause body movement. Normal age-related changes. People lose bone mass or density as they age, especially women after menopause. The bones lose calcium and other minerals. The spine is made up of bones called vertebrae. Between each bone is a gel-like cushion called a disc. The middle of the body, or the trunk, becomes shorter as the disc gradually lose fluid and become thinner. The spinal column becomes curved and compressed, or packaged together, and bone spurs caused by aging. The foot arches becomes less pronounced, contributing to a slight loss of height. Lean body mass decreases. This decrease is partially caused by a loss of muscle tissue or atrophy. Muscle changes often begin in the 20s in men and in 40s in women. Lipofuscin, an age-related pigment, and fat are deposited in muscle tissue. The muscle fibers shrink. The muscle tissue is replaced more slowly. Lost muscle tissue may be replaced with a tough fibrous tissue. This is most noticeable in the hands, which may look thin and bony. Muscles may become rigid with age and may lose tone even with regular exercise. The long bones of arms and legs are more brittle because of mineral loss. They do not change length. This makes the arms and legs look longer when compared with the shortened trunk. The joints become stiffer and less flexible. Fluid in the joints may decrease. The cartilage may begin to rub together and wear away. Minerals may deposit in and around some joints called calcification. This is common in the shoulder. Hip and knee joints may begin to lose cartilage, which is called degenerative changes. The finger joints lose cartilage and the bones thicken slightly. Note that finger joint changes are more common in women, and these changes may be inherited. Abnormal conditions common with aging. Osteoporosis is a common problem, especially for older women. Bones break more easily. Compression fractures of the vertebrae can cause pain and reduce mobility. Muscle weakness contributes to fatigue, weakness, and reduced activity tolerance. Joint problems ranging from mild stiffness to debilitating arthritis or osteoarthritis are very common. Involuntary movements or muscle tremors and fine movements called fasciculations are more common in the older people. Older people who are not active may have weakness or abnormal sensations, which is called paresthesias.
The last system is respiratory system. This system provides oxygen to the body, disposes of carbon dioxide, and helps regulate body pH. The gas exchange occurs in the air sacs of the lungs called alveoli and the capillary beds around the body. Without oxygen, cells will eventually die, and too much carbon dioxide in the blood will cause the blood pH to become acidic, which will interfere with the cellular function. With advancing age, the airways and tissues of respiratory tract, including the alveoli, becomes less elastic and more rigid, as well as the chest wall, which impairs the total respiratory system compliance, leading to increased work of breathing. In fact, the vital capacity or the maximum amount of air that can be expired after maximal inhalation can decrease as much as 35% by the age of 70. A decrease in blood level of oxygen, decreased activity of alveolar macrophages, and diminished ciliary action of the epithelium lining the respiratory tract occur. Muscles and other tissues that are near airways may lose their ability to keep the airways completely open. This causes the airways to close easily. Aging can also cause the air sacs to lose their shape and become baggy. Because of these age-related factors, elderly people are more susceptible to pneumonia, bronchitis, emphysema, and other pulmonary disorders. Age-related changes in the structure and functions of the lungs can also contribute to an older person's reduced ability to perform vigorous exercises such as running.
The respiratory illnesses that are common with aging. There are asthma, chronic obstructive pulmonary disease or COPD, chronic bronchitis, tuberculosis, and pneumonia.
Let's start with asthma. Asthma is defined as a common chronic respiratory condition that causes difficulty breathing due to inflammation of airways. Usually, asthma starts in early childhood years and progresses into adulthood. Adults tend to have a lower forced expiratory volume after middle age because of the changes in their muscles and stiffening of their chest walls. Older adults, specifically in their 60s, 70s, and 80s, can get adult onset asthma due to some several factors such as exposure to chemicals or irritants in their workplace, allergens such as cigarette smoking, some chemicals, dust, pollen may trigger at least 30% of adult onset asthma. Now, let's proceed to the second one. Chronic obstructive pulmonary disease or COPD is also a common abnormal condition in elderly. Age-related changes in the respiratory system are complex but characterized by a decline in FEV1, which is the amount of air you can force from your lung in just 1 second. A reduction in strength and an increase in inflammatory cell in the bronchial tissue. These mechanical cellular changes mimic COPD and can cloud the ability to diagnose obstructive disease in addition to exacerbating the pre-existing disease. So let's proceed to number 3. Another abnormal condition is chronic bronchitis. Chronic bronchitis is a type of COPD. So another thing about COPD, it is a group of lung diseases that make it hard to breathe and it gets worse over time. If if not properly medicated, of course. The other main type of COPD is emphysema. Most people with COPD have both emphysema and chronic bronchitis, but how severe each type is different from person to person. Chronic bronchitis is inflammation or swelling and irritation of the bronchial tubes. These tubes are the airways that carry air to and from the sacs into your lungs. This irritation of the tubes causes mucus buildup. That mucus and the swelling of the tubes make it harder for your lungs to move your oxygen in and the carbon dioxide out of your body. So let's proceed to the fourth one. And I think this is the most familiar one. Tuberculosis or TB. Tuberculosis is a disease caused by bacteria called Mycobacterium tuberculosis. This disease usually attacks your lungs but also can damage other parts of your body. TB spreads through air when a person with TB of the lungs or throat coughs, sneezes, or talks. If you have exposed, you should go to your doctor for a test. You are more likely to get TB if you have a weak immune system. So let's proceed to the last one, the fifth one to be exact. It's pneumonia. So pneumonia is an infection in one or both lungs, caused by bacteria, viruses, or fungi. The infection causes inflammation in the air sacs in your lungs, which are called alveoli. The alveoli filled with fluids or pus make it difficult for you to breathe.
In summary, according to World Health Organization, aging is a course of biological reality which starts at conception and ends with death. It has its own dynamic much beyond human control.